and Elliott. On today's show, we'll be looking at the link between housing and mental health with a perspective from housing advocates and providers. It is my great pleasure today to introduce two guests. To my immediate right is Elaine deColigny, who is the executive director of a nonprofit organization called Everyone Home. She has 20 years of experience providing shelter, supportive housing, and services to women, children, and survivors of domestic violence. She served on the county's Homeless Continuum of Care Council since 1997 and as its co-chair from 2002 until 2007. In that role, she developed Alameda County-wide Homeless and Special Needs Housing Plan, now known as the Everyone Home Plan. Welcome, Elaine.
Thank you. It's good to be here.
And to my far right is Robert Ratner, who for more than 4 years has held the position of Director of Housing Services at Alameda County Behavioral Health Care. He has more than 15 years experience working on housing as a healthcare issue. He got his public health and medical training from UC Berkeley and UCSF and has spent 6 years as a director of supportive housing program for formerly homeless individuals at Lifelong Medical Care in Berkeley. Thank you, Robert, for joining us.
Thanks for having me.
Thank you. So first question to kick us off, I'm curious if you could describe the relationship between mental health and housing and why housing is such a problematic issue for folks with mental health challenges.
First, when I think about the connection between mental health and housing, I think of people needing to have their basic needs met. So we all need air, food, water, and there's an element of housing which is about physical shelter and security and space. So physical health as well as mental health requires that we have a safe place to be, away from the elements, away from potential other things that might harm us either psychologically or physically. There's another element to the housing issue in regards to mental health, and the term homeless uses the phrase home rather than houseless. And the element that home captures, I think, is well picked up in Robert Frost's poem and other phrases where there's a psychological element. The Frost line that I like is, home is a place where when you have to go there, they have to take you in. So this idea that's more than a physical place. It's a place where you can rest and be yourself, and there's an element of security and safety, and your identity is connected with that physical space. And for people that don't have a home, the physical and especially the psychological or mental health issues are really extreme. So that's the first way I think about the connection. It's brought up as an issue in the field that Elaine and I work in part because there's so many people who have serious mental health issues that are literally without a house and without a home. Nationally, it's known that probably a third of the people that are homeless have serious mental health issues, and different communities have different rates, but it's a very large number of people. And there's a variety of factors that go into that, and I'll just touch upon a few of them. One is that if you have a serious mental health issue, it's very hard to be able to manage the things you may need to manage to obtain housing and keep it. So navigating the process of looking through a list of apartments and calling the landlord and having the credit check happen and getting your resume there, and especially in an area like Alameda County where housing is extremely expensive and there's a fair amount of competition for lower cost units, you have to be able to manage a whole bunch of steps to be able to get there. So if you're struggling on a daily basis to manage those kind of tasks, it's especially difficult. Some people with serious mental health issues are on Social Security disability because their health issues are severe enough that they qualify for federal benefits to be getting health insurance and income. The amount of money that disabled people get once they qualify for Social Security is so low that you can't even afford an apartment. So July of this year, the state is cutting back on their contribution to Social Security payments. So someone on Social Security will be getting $830 a month if they're trying to live in their own apartment or own home. And the fair market rent, which is a federally established standard for assessing what's the going rate for a particular kind of apartment, for a studio apartment is $974 a month. So we have some policy issues in that we, as a community, have identified a group of people who are disabled and unable to work. That's part of the definition of being disabled. And we are supporting them up to a very minimal amount, $830 a month in our community. But how can you afford housing when you're getting $830 and the cheapest place is $974? Another issue in the field of mental health is that there's a lot of stigma associated with mental health issues, and I think there's been a perception that if someone's struggling with psychological or mental health problems, that they need to be supervised and controlled in some way. Many people with serious mental health issues pre-1970s were in state institutions, and the premise there was that they needed to be supported and have oversight, and someone needed to make sure they were taking their medications all the time. They couldn't be out in the community. And as a result of policy shifts, funding for institutionalization of people with mental health issues, as well as the sort of movement to counteract that institutionalization, which is to help support people to live more independently in the community, resulted in a lot of people in a very short amount of time leaving more institutional settings into a community setting. And there wasn't enough support available in the community and enough resources for people to be able to afford the housing. So there's some studies and there's graphs that show the number of people who are in state mental health institutions, and then you see a concomitant rise as that number drops precipitously, number of people who are incarcerated, and a number of people who are in homeless shelters.
Interesting.
So there is a real policy flaw in where we put our resources for folks who have serious mental health issues. The other thing about this is that there's still a lingering paradigm in the healthcare field that housing is about a treatment facility. So if you're a physician or a nurse and you're seeing someone in the hospital, you don't think about how to discharge someone back to their apartment. You think about how do you discharge them back to the step down, the next level of care. So it's from hospital to subacute or skilled nursing facility. And then along that chain, there's really no one who's thought about how do we help support this person to get back into their home. And the healthcare field historically has been built around people getting care in institutions. So clinics, hospitals, drop-in centers. Very little of the service world is oriented toward helping people to stay in their homes. And that is a big contributor to housing problems for people with mental health issues. If folks are struggling to find and keep their housing, and the services that are available to support them are all away from where they live, and they have to get to a clinic, there's really no connection between their needs to continue to live in the house and what the service providers are offering. So I think for the healthcare field to be more successful, there has to be a reorientation towards supporting people to live in their own homes and to stay in their homes as long as possible. And then there's similar examples in the field of serving older adults. As we all get older, I think our preference would be to not end up in a skilled nursing facility, to be able to stay in a home with people we love, in a community that we want to be in. So that's going to require our healthcare system to change the way it works, to fund things differently, to support people to stay in the home rather than waiting until they get in the hospital and then discharging them to a skilled nursing facility. So those are some of the challenges and big issues associated with mental health and housing.
Next, I was wondering if each of you could talk a little bit about your respective programs, what you do and what they're about, and how they came to be.
Sure, so I'll start with that one.
Okay, great.
Everyone Home is the organization in Alameda County that's coordinating our effort to end homelessness by the year 2020. And we're working with all the county departments, including Behavioral Health Care Services and the Social Services Agency, the Housing and Community Development Agency. All 14 cities inside the county have adopted this plan. And the idea is that we're going to prevent housing crises for people who are at risk of homelessness, low-income people living with serious mental illness, and low-income people living with HIV or AIDS. And in cases where they do become homeless, resolve that very quickly and move them back into housing. And so we're working on this issue at all kinds of levels. We're trying to build more housing units, create more rental subsidies, And when I say we, I mean the partners of Everyone Home. So Everyone Home itself is a tiny organization. Everyone Home as a community effort is a big effort that involves dozens and dozens of organizations. So the big effort is building more housing. We are looking at policies that landlords have now about who they lease to and some of the unintentional discrimination that occurs in the housing market, particularly for folks living with serious mental illness, but also people with histories of homelessness and criminal records. And so we're trying to address those. We're trying to shift our focus in the homeless service field from keeping people in shelters and programs for a long, long time to looking at how quickly can we move them into their own housing. So instead of being homeless for months or years, they're homeless for weeks. So we're attacking this issue on all kinds of levels so that we hope that everyone in Alameda County by the year 2020 has a safe, decent, affordable place to call home.
And in behavioral health care, we're, as Elaine stated, a partner in the Everyone Home efforts, and we've benefited from Proposition 63, the Mental Health Services Act, which was passed by California voters in 2004 and was implemented in 2005. And the idea behind the Mental Health Services Act is that throughout the state of California, we've done a poor job of serving people with mental health issues, especially people with serious mental health issues. And the campaign really, I think, when you look at the poll results about why people voted for it, they wanted to see people who are homeless with serious mental health issues get off the streets and get the supports they need to live in their own home. And in our county, we really made that a priority. So we've done a few things to focus on people who have extreme housing needs, who have serious mental health issues. And those things include, we created a housing services office and drew some attention to housing as an issue within a healthcare environment, which sounds like a minor thing, but is actually a significant thing for healthcare to pay attention to housing. We created some new programs that are called full service partnership programs, and they exist around the state. The idea behind the full service partnership model is that you create a team of service providers that provide the whole range of supports that people need: housing, employment, physical health care, mental health care, help with benefits, helping get your ID, and all those sorts of things. And they're available 24 hours, 7 days a week to support people. In our county, we decided that each of those programs should have some money to subsidize people to be able to afford housing in the community.
Yeah.
So through that effort, we've helped 300 people who were homeless or at risk of becoming homeless get into permanent housing and stay in permanent housing. That's been very successful. We also created a fund to enable people to pay the rent or pay a security deposit. So if they're homeless and they need help to just get into a place, we've got financial assistance there. Or if they're at risk of losing their place because they're in the hospital and they can't pay the rent, or they just can't afford it for a month, we created a program for people who are getting services in our system to get that financial assistance. And last but not least, we in the state invested we're still investing $20 million of Mental Health Services Act money in the creation of new affordable housing projects for people with serious mental health issues. So we're close to fully investing that allocation, and I think we'll be around creating 150 new apartments that are going to be affordable for up to 55 years for people in the target group. And in addition to those units, we're creating more affordable housing in our county, which will help address homelessness more broadly and housing issues among people who are disabled who have very low incomes. So there's some of the programs we've worked on. We're also trying to do broader education and awareness around housing issues and trying to shift the thinking away from we're going to place people in their housing to where do people want to live, how can we support them to move into that place, help them to keep that place. So that's an uphill challenge, sort of changing the way that the healthcare field thinks about housing.
Yeah, that's actually an excellent segue into my next question. You touched on it a little bit, especially with all the recent innovations really in these programs, these housing models. But how would you say these programs are changing or influencing the previous housing model, maybe even pre-2004? How are they really different?
I think it's been a gradual process for people to realize that folks that the clinical staff thought could never make it in their own apartment actually can if they have the right supports. And it took actually starting up new programs and having examples of folks who can be successful in getting jobs and in finding and keeping housing, that the old way of viewing them and thinking about their needs was that they could never make it and they'd have to go through a series of programs before they'd be ready to get into housing. The key thing is you need an adequate amount of support for people, and you need to have that on the front end, and it needs to continue. I think a lot of efforts at helping people to get housing have not adequately resourced the services and the housing funding to be able to help people to keep their housing over the long term. So we've been chipping away at the way in which people think about housing by using these examples and sharing stories of what's worked and what hasn't worked. With the money that we had set aside to build new affordable housing, we've done a lot of work with affordable housing developers, which are typically nonprofit organizations that build and develop affordable housing. And often affordable in the affordable housing world is not always affordable to people on SSI. Right. So, you know, a family that earns $44,000 a year, family of four, would be considered eligible for most affordable housing that's created. So together, Behavioral Healthcare, Everyone Home have really been trying to encourage our affordable housing development community to build more units that are targeted to and financially affordable for people who are disabled, people living on Social Security and fixed incomes. And we've been successful in that in part because we actually had money. So if you want our money, we expect this of you. And I think that's driven some policy changes and increased awareness among the affordable housing community. In addition, we've done some education. We've brought mental health first aid, educational materials, and just sort of workshops to affordable housing developers and let them know things like 1 in 4 people in the U.S. have a mental health problem every year, and it's very common. And just because you don't know the people in your building who have a mental health issue doesn't mean they're not struggling with it, and that the stereotype in the media of someone with a serious mental illness is not the vast majority of people. They can be quite successful in housing. And we've done some work to try to link the housing world with the services world. So educating them about what resources are available to respond to issues as they come up in housing. So we've done a variety of things, and there's a fair amount of challenges along the way, but I feel like there's been significant progress from 2005 when the Everyone Home Plan got started and when MHSA got started.
People may have housing crises. They can't pay the rent, or they have to move, and that could be because there's a fire in the Oakland Hills or an earthquake, or they can't pay their rent, or they get sick. But those don't have to lead then to someone spending years on the streets or in and out of shelters and in and out of institutions. And we talk about the evolution of of dealing with homelessness in our society as in the 80s when we first became aware of it, and a lot of it was the results of deinstitutionalization of folks living with serious mental illness. But also a divestment from the federal government and the state government in creating affordable housing. So less and less people, there were more people who didn't have housing they could afford, and some of them ended up on the streets. And so what we thought was, okay, we'll open a shelter, they'll have 3 hots and a cot, which that was our lingo in our industry, so 3 hot meals and a cot to sleep on. Then we started realizing that the folks who were coming to stay in these places, in these church basements and rec halls and armories, had a lot of other complex things going on in their lives. And so our services got more and more complex, and we felt like we needed to have people stay with us longer and longer and get them ready to move into housing. And so we wanted to fix up all of their mental health issues and all of their addiction issues and all of their family issues, and then, you know, their childhood issues. And pretty soon, before you knew it, they were homeless for 5 years or 10 years. And so we're really flipping the thinking, saying the first thing someone who doesn't have a house needs is a home. So do that first, and then all the other complicated things they're dealing with, A, will get better when they get in that housing, and B, can be supported over the course of months and years in stable housing so that they get better and at a pace that works for them, as opposed to sort of whipping them into shape to be ready to move into housing. So that's a big change in how we think about our work, is rather than getting people ready to be housed, we say house them first and give them the supports they need to become healthier in the housing they have.
Mm-hmm. In the last few minutes, for all those folks watching out there, what action can people take, whether they are consumers of mental health services, whether they're landlords, whether they're providers and advocates? It's obviously a very big issue, a multifaceted issue. I'm sure there's lots of steps that folks can take to help.
Some thoughts I have for mental health consumers around what they can do to access housing. First thing is, I think, getting more familiar with what their rights are and what their potential responsibilities are as tenants. A number of mental health consumers live in these shared housing situations, either licensed or unlicensed facilities, and I think often they don't realize that there are places they can go if the housing is not safe, or if they're not providing meals like they promised, mm-hmm. or if they're locking folks out during the day. And I think learning those resources will be really helpful. I think also helping folks to realize that finding housing in a community like Alameda County is a lot like finding a job, because there's a lot of competition for housing. So I often talk about a tenant resume, and there's things that landlords are able to look at in someone's record. So they can look at what's your income, whether you have an eviction on your record, whether you have any criminal history, and your overall credit and sort of experience with other housing. And I think for a lot of mental health consumers, it can be very intimidating when they look at an application where they're asking questions about your finances and your credit and your criminal background. A couple of things that I think are important for people to know. You don't have to disclose that you have a mental health issue. People aren't allowed to ask those questions. They're only allowed to ask about those things that I mentioned a moment ago. And you do need to be honest when you're applying for housing. But you can also ask for something called a reasonable accommodation. So if there's something that happened to you in your past that shows up on your record, it's a financial problem or a past eviction, and those issues have been dealt with, you can ask for a reasonable accommodation in the process the landlord uses to select tenants, so that they're looking at where you are now and not where you were in the past, and taking into account that any issues that may have come up before might have been related to a health condition. I think a lot of consumers don't know about reasonable accommodation, how to make that request, and how to have that dialogue with the landlord. I also think learning about how the affordable housing world works. The things that I often talk about are apply to as many places as possible, because the wait list is long. Make sure you're tracking all the places that you're applying, and make sure that you notify those places when your contact information changes, because often you'll get put on a waiting list, and if you have information that's not up to date, they'll try to contact you when your name's at the top of the list and they can't find you. And then they'll move on to the next person, and you will have lost an opportunity. Mm-hmm. So I think getting on as many lists as possible. I think sometimes there's a hesitancy to get on or even to apply for affordable housing, because people are concerned that if they get to the top of the list, they're going to have to take it. Well, that's not the case. It's an opportunity. You can say no, but if you don't get on the list, you don't have a chance to really be considered. So some of the things that I think can be helpful for consumers. Another thing is that I remember when I was a student, I had very little money and I was living in a high rent area. The solution was find people I want to live with and share the costs. So I think that there could be more of that networking that goes on among mental health consumers, and finding people that you'd like to live with and live in a house together, and apply as a household for housing. And I don't think that a lot of consumer service providers, family members think about that as a possibility.
And I wanted to build on Robert's comment about reasonable accommodation. One of the things we're doing in Everyone Home is talking to landlords about setting up a leasing practice of encouraging possible prospective tenants to ask for reasonable accommodations. Usually what the practice is, the landlords look for criminal background or bad rental history and or low income, too low income, and they just automatically reject folks. So another thing I would say to consumers is if you've applied for housing and you're rejected, appeal.
Right.
A lot of people win on appeal, but a lot of folks don't even appeal. What we're encouraging landlords to do is, rather than go through the reject and appeal and then accept process, encourage people to ask for a reasonable accommodation at the beginning, talk about the issues that they may see in their application, and explain why those issues occurred and why they won't occur now as a tenant. So we're encouraging landlords to have a little bit more individualized approach to reviewing tenants. We are also wanting to say to funders of affordable housing, city governments that give money to affordable housing, insist that some of those units go to extremely low-income tenants and persons who've had histories of mental illness, histories of homelessness. It's public money. If we want to solve homelessness, we've got to make sure our dollars go to building units for those folks. And then the other thing that I would say to advocates and neighbors is most public money that goes into housing has to be approved at the city council meeting or planning department. And typically what happens in communities is folks will say, I want to solve homelessness as long as the housing is built to house people somewhere else besides my neighborhood. So don't be a NIMBY, a not in my backyard, be a YIMBY, yes in my backyard. So be the people that go to city council and say, yes, affordable housing upgrades the neighborhood, it improves the appearance, it diversifies the neighborhood. I want this building, I want this property in my neighborhood. Because city councils will sometimes back away from these kind of funding projects because of the uproar in the neighborhood. So create the counter uproar for solving homelessness. So those are some ideas.
Thank you so much, Robert, and thank you so much, Elaine, for being here today. I certainly learned a lot in the last half hour, and I'm sure everyone at home did too. Thank you so much for watching out there. We'll see you next time.